Good morning, friends in the US. Good evening to our friends in India. We'll go
Hi.
ahead and get started. Um, so it's wonderful to see many of the familiar faces, some new faces, and the format in the past Heartful Living sessions have been first half an hour would be a presentation, 15 minutes meditation, and then 15 minutes of question answers. This is like a follow-up or a advanced level session where we just want to reinforce to the people who already attended the summer program, but at the same time be able to give people some insight, those who not yet had a chance to listen in on any of our prior sessions or its recordings. So I felt last session 2 weeks ago was interactive and pretty informative for new people and for people who've been with us for a while. So I thought we could follow the same format, which will be first we'll open it up for anybody to ask quick questions or share their experience with HiLife, how they have incorporated some of the things that we talk about. And that way, for the new participants, it'll be more motivating and it'll be hearing from others in the same type of situation, sharing the journey. So now we'll open it up for anybody who wants to have quick question answers or who would like to share their experience with us for the last several years or for the last few weeks, few days. Anybody who wants to ask questions, we open it up now. So you'll have to unmute yourself before you talk to us. Any questions about what you might have attempted and where you're struggling with, or any specific questions on how to do this, do that, how this works with my medicines, anything at all? You're most welcome to ask. 2 weeks ago, we had two people share their experience with how the whole program works for them in the last few months, and they showed so much more confidence and energy. So that was very nice and motivating for new participants. But if you're really struggling, we want to know that also. What is your biggest challenge? Why you don't think this program might work for you? So that also we are so happy to hear, so that we can navigate our way through the challenges that we face individually or as a group.
Anand, I would like to speak
Please,
hi to
please.
everybody.
You can
So,
briefly introduce
I,
yourself to the group and then
yeah,
you're most.
I'm Maya Shamsundar, my husband. And incidentally, I'm Anand's aunt as well, aunt-in-law, you could say. So, I'm very new to this intermittent fasting in the sense that I have been able to try only going the 14-hour way. And the struggle I feel is like I feel I'm not able to eat enough within that window of time that I have. I follow like 7 o'clock in the evening as I finish my meal, and then I eat again only in the morning at 9. And from 9 to 7, I'm used to having 3 meals a day. I'm not able to cut it down to 2 meals, and I'm not able to eat the same quantity I was normally eating. So that I don't know, it's not bothering me, but I don't know whether I'm going to lose out on nutrition or I'm missing something. So that's a concern for me. So how do I? But I have noticed a lot of benefit from this in the sense that I used to have a lot of pain in my joints when I would wake up in the morning, and now I find that it's completely gone. Doing this, some of the things that I'm noticing right now, obviously, which I have noticed.
Excellent.
So, is it okay that I eat less in this time frame? Will I've not lost weight or anything. My weight is constant. There's been no change in that sense, but it's a psychological fear that, okay, I'm not eating enough. I may not be getting enough nutrition. Is that wrong, or is
So,
that...
So for our group, why don't you share why you're doing this fasting? What are you hoping to achieve through doing fasting?
Um, Basically, I mean, I was thinking that it would probably, be helpful somehow. And I had small, issues like I'm hypertensive. Then I found that I have some small thyroid irregularities, and I detected as borderline, pre-diabetic, which was a
Your
big
cholesterol numbers
surprise.
were also a little bit on the higher side, if I remember, correct?
Sorry.
Cholesterol numbers were also a little
Yes,
bit on the high.
yes, that was surely because of not taking my statin or whatever. And
See, no, no, not taking the statin is not the reason for the cholesterol. The cholesterol is high, for that we take statin. Okay, so the answer or suggestions that I have for you are these. First was for you to taste fasting, which you've done now for I think 2 months. And
yeah,
the important thing is you completed a loop where you think about it, you try it, and then you also found it beneficial in some aspects, like less
yeah,
joint pains and little more energy levels. So this is, I would say, the best start to this type of self-inquiry. So that is what this whole heartful living sessions are about. Really, it's
okay,
about self-inquiry, trying to understand ourselves at a deeper level. And this is what in the last 10 years we have used in mid-Missouri to get so many of our patients to give up their medicines, get stronger, healthier, and gain more confidence. Give me 1 second.
I was supposed to send you the link.
So, uh, the first thing that we should look out for is a reduction in the blood pressure, cholesterol numbers. Most importantly, the insulin requirements of the body, the endogenous insulin that we all produce, will become so much more efficient in bringing the sugar levels down. So that is the best thing that can happen with the 14 hours food free and calorie
Okay,
free time interval. So that you've already done for a few months. So I
yeah,
expect that your hemoglobin A1C and your fasting and postprandial sugars will already be better compared to
better.
what it was a few months ago. That would be the first steps. And you are already on the lean side. So the big picture goal
Yeah,
after 2 years, 5 years is not for you to lose a ton of weight. It is
no,
to continue with these patterns, and by doing this, you'll gain more confidence. See, you have thyroid issues. I don't have the research evidence to say thyroid problems get better. But indirectly, we know inflammation comes down, immunity gets better. So I believe autoimmune issues that connect with thyroid problems can also improve. So if you continue with this 14 hours, 6 days a week, and one day, if you can
yeah,
take it all the way to 18, 20, 24 hours, if you are able to try that, that might have an extra benefit. We are talking about two or three different things. What is the benefit of limiting calories? Throughout life, we need to take in just as much calories as our body burns. And if we are on the
yeah,
overweight side, we need to find ways to cut back on overall calorie consumption. That's across the board for everybody at all ages, whether you're a heart patient or if you do have high blood pressure or do have diabetes, it doesn't matter. Everybody needs to make sure our calories are not excessive to our needs. That's the first thing.
okay,
This fasting for 14 hours, this has numerous benefits by improving immunity, reducing insulin resistance, and blood pressure control gets better, all these benefits. When you go up to 24 or uh, sometimes even up to 30 hours of fasting once a week or once in a month, also that is beneficial in reducing long-term risk of dementia and cancer. This I did not know, and this is not my field. But now, in the last 3 to 4 years, we are seeing so much more interest in using natural ketosis that happens when you fast for anything more than 12 hours, you go into natural ketosis. So, if you're doing 14 hours, 6 days a week, you're tasting it. But when you go beyond 20 hours, the benefit with preventing dementia down the road is so much more. And cancer, 70% reduction. People are living longer. Wherever we are in the world, we should be grateful for living in 2020, because this is the
Yeah.
best time in human existence as far as longevity is concerned across the world. So when we live longer, our risk of dementia and cancer, we need to minimize as best as possible. For that, my suggestion, which is not easy, but it is possible, especially if you are not insulin requiring diabetic. For most people, it is possible to go up to 18, 20, 24 hours once or twice a month. So that would be
Okay.
something you can gradually try on your day off when you are not challenged with too many commitments at work or otherwise.
Yeah.
Explore. When
No,
you
I think it's more in the head, like I say, I feel I'm not eating enough. It's all in my head. Obviously, I don't need it because I don't feel hungry, or I don't. It's more like my fear. Am I eating too less? Am I? Is my body
so
getting sufficient nutrition?
two things are: one, plenty of water. Second thing is smiling. When we smile, we relax the system and tell the subconscious that we are not starving. The difference between starving and fasting is starving, we don't have food, we are searching, we are hungry, we are anxious. That is what our ancestors had to deal with for millions of years. But now, when we are fasting, we have the luxury of eating whenever we choose to. We are just postponing it by a little bit longer. And when you asked about nutrition, the answer is every meal, make sure it has color. It should come from
Yeah.
fruit and less cooked vegetables,
Food.
and that sort of nuts, and this type of mixing it up with the variety, we will get the nutrition that we need. We don't need
Yeah.
vitamin supplementation
You
all.
know my eating habits, they're pretty healthy.
I try to
So,
answer everybody when I answer one person. So that's why I say generally, as a cardiologist, we've discussed this in our annual meetings nationally, and there is no evidence for nutritional supplements. There is such a
okay.
huge market for taking 6 different supplements, thinking we are helping our health.
No.
But the reality is we probably don't need any of them. If we eat right and do things basically right, we will be in good shape. Excellent. Thanks for opening up today's session with very
Thank you.
valuable
No, I'm
questions.
also like very happy with what I am trying. So I think we have to thank you for putting us
Good.
thought that way.
Welcome. Most welcome.
Dr. Anand,
Yes, sir.
Dennis Bach speaking.
How are you doing?
I missed you last week, but I watched the recording yesterday, so I appreciate that.
Excellent.
I'd like to say that I've been fasting 14 hours a day virtually since we started this last spring or summer.
Why don't
And
you
I have
introduce
found,
yourself, Dennis, to the group? Tell us one sentence or 2 sentences about who you are so that they'll know what.
I'm a retiree living in Colombia who was connected with Dr. Anand a couple of years ago now, I suppose, because of an aneurysm that was discovered while checking something else out. And I feel like I have benefited greatly from my association with Dr. Anand and this process. But thinking of your auntie and her comments, one question I had, which she answered, was she still feeling hungry when she thought maybe she wasn't eating enough? And the fact that she's not still feeling hungry, in my opinion, would tell you that she's eating enough.
Excellent.
And I find it very easy to go without food for 14 hours. I try and be done eating before 6:30, and I virtually never have breakfast until 8:30, 9:30, sometimes 10 o'clock. And for me, I haven't actually lost weight either, but the benefit I have found is that my weight has stabilized. I don't fluctuate up 5 pounds and back down, and that type of thing, because I'm eating a good breakfast later in the day. And so I'm eating less at noon and not feeling hungry in the interim, and then having my normal large meal in the evening. And I don't eat after that. So my weight has been very, very stable all summer, where it used to fluctuate up and down 5, 6, maybe sometimes even 7 pounds if we had company and I splurged and that kind of thing. I don't find that at all anymore. And I was doing the 24-hour fast once a week as well. I stopped that temporarily. I'm going to pick it back up again. But since I saw you last, I had 2 major back surgeries, which I think you knew I was going to have. One on August 4th and the other one on September 10th. I'm doing remarkably well since both of those major spinal surgeries. And I think in a few more weeks, I'm going to be back to doing the 24-hour fast as well.
Excellent. So,
my struggle is with smiling. And I found that interesting in the discussion from 2 weeks ago. The comment that children smile 30 times an hour and our goal is 20 times an hour. And yet I saw something in there that said at least smile 3 times an hour. So, I'm probably easily doing that, but I'm a long ways from smiling 20 times an hour. I think about it, but I'm not somebody I'm smiling inside all the time when it doesn't show on the outside.
That is good. So, that is actually better. So that is what we really want to achieve, that inner peace and gratitude and calm. Despite the COVID, despite the numerous challenges our society is facing, we need to find some connection to find that gratitude with life itself. So the smile is just the window, or I would say the entry into that inner gratitude. So whichever we come to first, I'm fine with that. But all have their benefits. The 3 smiles an hour thing is the average for human beings who are happy.
Yes.
Average human beings overall across the board smile 1 or 2 times, whereas the happy ones smile 3 times. We are asking you to bump it all the way to 20 times an hour.
I will say it might be easier to smile once this election gets out of the way.
Sure. We'll try to stay out of politics here, because people from all over the world, but we all have to deal with our reality, unfortunately, and do the best we can and try to cope with everything, including the forest fires and the hurricanes that are now a part of our day-to-day living.
Yes.
Excellent. I'm so glad that 24-hour also is something you're going to get back to. And that is where that self-inquiry becomes a reality. When we say we are hungry, and still we are finding that smile, that can only happen out of our subconscious level of confidence. So that is the self-inquiry or inner journey aspect of fasting. So
the 24-hour fast.
Yes.
The 24-hour fast actually was much easier to do than I expected it would be. I say that for the benefit of your auntie if she's not doing that fast, because what I found is that I did have times during the day where I felt hungry, but I just drink a little more water, and first thing you know, I wasn't feeling the least bit hungry anymore, even though I was thinking about it. And it really was not difficult at all.
I'm glad. Many of our cardiac patients have been pleasantly surprised, despite numerous health issues and being on many medicines, including for diabetes when they're on pills. Still, they're able to go 24 hours, and they come back and say, "Doc, I can do it twice a week, thrice a week now." And we have patients who've done it for 6 days of the week for more than a year now. That means basically 6 days of the week, they're eating only 1 meal a day. So we have heart patients in their 70s and 80s doing that. And they've lost a lot of weight, and still they are on the bigger side. So this weight loss journey is, for many people, a lifetime journey. So staying hungry is what we need to become comfortable with for them. But for others, we can have good amount of food if we are not trying to lose weight. If our BMI is well below 25 and our risk factors are under good control, we don't need to stay hungry. But once a week is good, and 14 hours, I still believe, is going to only keep us stronger and healthier longer.
Thank you for saying that. I shall definitely try the 24-hour. Dennis is very inspiring, the way he has, spoken and about me and my habits and what it is. So I'm glad to hear that.
Hi, Dennis.
Hi.
I'm also in the same boat as you. Yeah,
I'm sorry.
I'm also in the same boat as you. I find it very difficult to do 14 hours, but I find it very easy to do 24 hours.
Oh, now see, the 14-hour for me is a breeze. That I don't even think about it. But the 24-hour was also surprisingly easy.
All right. But the problem is 14 hours every day becomes a bit of a obstacle. But 24
If
hours.
if you do it the same every day, it will become your routine and it will become normal for you. Trust me.
The mind doesn't accept it. I tried. Now I've switched to 2 days of fasting a week, a 24-hour fasting.
Extremely good. So these
patterns that's better than
really individualized. So for some people, it is easy to do one. For others, it is easier to do another. And I'm so glad Chittappa is trying to do 24, even twice a week. That is great. So whichever you are able to follow is fine. But all these things lead to one common thing, which is connecting with our hunger, through which we are connecting at a deeper, more profound mind-body connection that will lead us into, I would say.
Also, I haven't been able to still follow your advice of doing a little bit of weights, light weights. I think I shall get onto it more because I just couldn't get the weights based on this COVID problem. But now I think I should be able to latch onto it and try some light.
Chittappa is talking about doing weight training. Let's spend another couple of quick minutes to remind people about what that is. Earlier, I would say for the last 50, 100 years, we've been trying to tell heart patients to only do aerobic exercise, cardio fitness, which is walking or maybe bicycling or swimming. We've discouraged from weight training. We're really building muscle. But in the last 10, 15 years, we have a lot of evidence coming, especially from Scandinavian countries, that weight training is beneficial for heart patients. Whether anybody beyond the age of 40 years, we start losing our muscle mass and bone density and risk for osteoporosis, falls, balance issues, all these things slowly increase. We use the simple word called frailty, becoming more frail as we go older. So to reduce that risk, the best type of exercise may be getting 2 times a week for 20 to 30 minutes of resistance or weight training. So this, I believe, especially for cardiac patients, is safe and useful not only to stay strong, but also to improve calorie metabolism. See, when we are reducing our food intake, either by a 24-hour fast or by a 14-hour, several-day fast, what the body understands is it's not getting enough food, and it's understanding that correctly. And the way it makes auto-correction is by reducing our basic metabolic rate. In several ways, that is also beneficial. But if you're trying to lose weight, it becomes a resistance point. So you cannot lose weight once the body resets to a lower metabolic rate. So going into more fitness, walking is great, but weight training really allows the body to start burning calorie at a much higher level. And for people who want to continue to lose weight, resistance training adds so much more value.
A small question, Anand. Is there any set routine that you have in mind that I can pick up from the net or anything like that, the weight training?
Let me search for it. In this COVID world, it's not easy to give very specific tips, but online there are so many tools, I would think. But we haven't created our own program. But right now, at our VA hospital in Colombia for veterans, we have a home-based cardiac rehab program. So if a heart patient wants to do exercise at their own home with resistance and every other program, we have our own supervised training program. But for healthy people like you, we don't have any protocol that we've established. But you can try low weights a little bit, 10 reps, something like that. But more detailed discussion, I don't have yet material available. We are in the process of building some more, but we should make it.
It's mainly because starting something new, I don't want to do the wrong things, because once you latch on to the wrong things, you don't realize how it takes you off the scale. And it gets you into a lot of trouble before you realize you're done.
Now, many fitness trainers are available online, both in India, Europe, and in the US. So my suggestion might be for the first 2 or 3 sessions at least to connect with them and do it one-on-one with them on their end, in the computer, supervising you doing it at home. That one-on-one, if you do
Doctor,
even a few, that will give you the
Okay.
confidence you're on the right path. We don't want to strain or stretch or pull any muscles when we are beginning the process. It'll take you 2 steps back when you're trying to take 1 step forward. So that might be the simple.
Dr. Anand,
Yes, sir.
could I make a recommendation?
Please, please.
Prior to my surgeries, I was using a YouTube video called Has Fit, HASFIT. They have a whole range of aerobic and non-aerobic weight training, stretching exercises for beginners and all levels. Look it up and search out which fits your need the best. Has Fit. They're excellent.
Why don't you also put it in the comment section so people can see that, Dennis?
Okay, I'll see if I can find that.
Sure.
Anand, did Sham share with you that some of his medications for his diabetes has been reduced with this?
Not really the diabetic, the thing, but the hypertension.
Excellent.
The thing I've gone off, taking morning and evening, I've gone off the evening one.
I would say the most important aspect of this program is that you keep liking it, take ownership for it, and feel proud that you are working in this path.
Okay.
And you will find the results will follow up by themselves. Don't worry too much about, did I come off this medicine? Why is my graph not looking as great as some of the graphs you see on video?
Okay.
Things like that. But this program will show its results. The biggest result is you should like it every day. You should look forward to it. If you're not looking forward to it, that day don't fast, that day don't exercise. You find the energy internally, it should be effortless. The whole program, the whole exercise is in finding it within ourselves. So that is what I would request you to very quickly connect with.
Yeah, it has a nice feel after you fasted. And one of the things that the plus point is other people have now started saying you're looking a lot slimmer.
Good.
So, which is a huge boost for all the effort.
Confidence. Excellent.
Yeah.
So this is the COVID challenges. Otherwise, we are all not doing the type of work that we are used to doing. Yes, sir. Nice that you joined us.
Hello, Sam, Maya, Anand, and dear friends. The important point I want to drive along with Anand is not that BP has come down, sugar has come down, not but your exercise, everything, Sam. The moment when you are smiling, that will bring down everything. That's what Anand was telling. All the time, keep smiling, be happy, make everyone happy whom you are seeing. That will bring down all the diseases. And you must be motivated in doing the exercise. Don't go in depth about doing that exercises, how one should be, all the things. Don't be counting these steps, that steps, these minutes. Doesn't matter. Why I am saying this one, most important point, as has been stressing, very important thing I would like to say is only one point is, any time, any moment of your life, you must be happy. Never compromise happiness. And most important thing I would like to stress here for all my colleagues here, you have got one heart on the left side of the chest. Please remember, 2 more peripheral hearts are there, second and third heart in the calf muscles. That one can activate the calf muscles, the peripheral hearts, only by regular exercises. And as Anand was telling about muscle resistance, one also will increases the power of the calf muscles. So please remember, 3 hearts you have got, and other things also must keep in your mind. And I am very happy, Anand.
Thank you, Dad. Let me share a few slides. Can request everybody to mute your systems so that another 10 minutes, I'll quickly share a few slides, thoughts for today, and then we can do a quick wrap up. So 2 weeks ago, we met and we heard from a few of our patients who've been with us for several uh, I would say, months who are showing good results, and friends in India who showed some great results. Today, we wanted to highlight this BEFIT scale. So that's what we're going to talk about today. Next Monday, we'll talk about experiencing life outside the box. We'll again be covering quite a bit about exercises, both today and next Monday. So our disclosure is HiLife Journey. And this is a conference that I attended last week, which is about holistic and integrative medicine. And look at the number of specialties that are included. Numerous health providers are included in this conference. And it is surprising to say that they are able to connect with the whole person and the overall health issues so much more, I would say, intuitively than our Western medicine does. So I feel that our Heartful Living is more aligned with holistic health than with the traditional Western medicine. So this is what we presented at the Academy of Integrative Health and Medicine last week, how hunger and gratitude can be combined towards sustaining significant weight reduction. So this we have discussed in June and July. So our participants have been familiar with this, but we'll come back to this hunger gratitude experience. We've talked about it, I guess, in the last 20, 30 minutes about how we can fast and how we can smile and be grateful for being hungry. So that's what it comes down to. Saying, I'm confident that I can postpone my next food intake a little longer, maybe a little more longer, by drinking some water and smiling and being connected with gratitude. This is a type of prayer or self-inquiry. And in all honesty, I believe this is the best way to gain inner confidence. So this is another meeting that happened a few weeks ago, where at the National Rehab Society, we presented how exercise smile combination may help heart patients do better. So this is what we presented there. We all know that heart disease, despite the COVID challenges, remains the #1 killer. And 80% of heart patients end up being sedentary. This flow phenomenon is well described, especially in athletes, and it can enhance exercise compliance in heart patients. So Heartful Living is our unique cardiac wellness program that has been prospectively targeting this flow phenomenon in heart patients for the last 5 years at least. And we have much of these patient stories in our website and prior lectures. So this is what it comes down to. On the x-axis, if you say a tennis player is 1 year, 2 years, 3 years gaining his confidence, his skills, and the difficulty is the opponent on the other side of the net. If somebody has extremely good skill and we are not that good, we'll be very anxious on the tennis court not to look like a fool. But if we play with somebody who doesn't have much skill and our skill is better, if, for instance, I've been playing tennis for 20 years. If I play with somebody who's never been on the tennis court, I'll be bored. So the idea is not to avoid boredom, to avoid anxiety, to find flow. I have to find somebody who has some skill and some interest and physical fitness that can play and compete similarly with me. So it doesn't mean that every time we match up in skill, we'll enter flow. It only gives us the opportunity to enter that flow state. That's what this is. Intrinsically enjoyable, exceptionally positive state of mind that is possible when we challenge ourselves appropriately in something that we are skilled and we are interested in. That's what this flow is. Okay. So how do we combine this flow and this smile experience? So this is what we call ease. Exercise, which can be either aerobic, interval training, weight training, which is resistance training, and participating in sports, despite having heart disease, bypass, stents, anything. We have had so many of our patients get into sports. And then awareness is the A component, and that is by the Bogue Modified Dyspnea Index, which is 0 to 10. And we encourage our patients to gradually increase that from a scale of about 3, 4, 5, just after a heart attack, to about 6, 7. And for interval training, they can go all the way up to even 8 or 9 for a few minutes. So that's what is interval training. 4 minutes on, 4 minutes off. 4 minutes on, 4 minutes off. Like that, they can do 4 sessions. And that gives that much more confidence, apart from the traditional cardio fitness training, which goes to only about 5 or a 6 out of 10 in your intensity of exertion. The last thing is the smile experience. We're asking you to exercise, we're asking you to grade it, which is the awareness, and finally we're asking you to also smile. It can be physical smile or internal smile, whichever thing. It should be relaxing, and you should be able to visualize feeling 50% of your weight, whatever your weight is. So think that you're lighter as you're exercising. So that is the smile experience built into this exercise. And so active relaxing with self-suggestion of being lighter and consciously smiling while we are physically exerting and challenging the body. So this BEFIT scale we have come up with based on looking at several other scales and our own personal experience with this flow phenomenon. So the post exercise, so you don't measure this while you're exercising. Finish the exercise, whatever it is, for 20 minutes, 30 minutes, 40 minutes, or some sport activity that you've done for that day. And after you had a chance to catch your breath, relax, cool off, then look at what I'm showing you here. So if you really enjoyed that exercise, looking back, I performed beyond my expectations. In that scale of 1, 2, 3, 4, 5, how much you agree with that? 5 is you agree a lot. 1 is you don't agree with it. And second thing is things happened effortlessly and I felt weightless. Again, grade that. It was a fun and rewarding experience. I look forward to going back to that sport or exercise or challenge. It may be taking a walk around your neighborhood. It may be cycling for 2 miles. Whatever it is that you're comfortable exploring, you're grading it after the completion of the exercise. The sense of myself, I was lost, but the intuitive awareness of participating in the exercise was well intact. So that is the fourth thing. And the last thing is this time gets warped. It can be that time seems to speed up or slow down, but time usually stops and long periods feel like a blur or like a moment. So this is this experience of BEFIT scale. So in this scale, we've had people score themselves. A lot of them score of 0 to 13 are the traditional, I would say, sedentary people who are willing to explore exercise, but they still look at exercise as a job to be done for the sake of their doctor. Okay? But once you start really taking ownership, liking the exercise, your score will improve to 14, 15, 16, 17, where exercise is overall in the same 1, 2, 3, 4, 5, you're grading it as 5 things. And if you're getting 15, that means you're averaging 3 all around. So this is mostly active people who recognize, recollect as exercise as an uplifting experience. So when people get 20, 22 score, they are not looking at exercise as fun. They're looking at it as their life's highlight. So this is what they're living for. So this is true enthusiasts who achieve this level of flow briefly. Even then, this flow does not happen every time. It happens only once in every 5 or 10 sessions. Despite that, this exercise is a big part of who they are, and they take so much pride in whatever they're able to do. So we have 75, 80-year-old heart patients who share with us their trophies and medals from participating in athletic events, despite having stints in the last 5, 10 years. So there's no age cutoff. We don't need to compete in Olympics or a Wimbledon or a French Open, but still we can compete with ourselves to push our limits and with our local events, whatever is age appropriate, and gradually gain that confidence. Yes, this is what defines my present life and my future. But this should happen intuitively. It shouldn't be forced. But this is the scale that we had several cardiac patients move through and score themselves. You don't have to share it with me or with anybody. This is some scoring that you do for yourself. And all this will be posted in our portal. And if you email me, I can share these slides if you prefer it that way. So this is a 50-year-old engineer that had a true heart attack. His heart stopped, but luckily it was in the emergency room. They were able to revive him. The second patient is a professor here at MU who's been pretty sedentary before the heart problem that he had. And the engineer, to start off, had a weaker heart. He participated in cardiac rehab, and after 3 months, his heart function improved. But this is a graph that we've shared in the past where his dyspnea index, which is 1, 2, 4, it goes all the way up to 10 by about 20, 30 minutes on the treadmill. And his heart rate is going from 60 to 125. And sometimes, 1 in 5 times, his dyspnea drops off significantly, although he's continuing on the treadmill. And this is when he's entering that flow. It doesn't happen every time. He has so many criteria. He should have had a light dinner. He should have a clear mind. He should not have any time pressure when he gets on the treadmill. And he finds that after he finishes the treadmill that he has entered that. You cannot force yourself to enter into that flow. But he has done this routinely now for 2 years on several occasions, and he truly enjoys exercising. That is the message about why do we even talk about flow? Because we want to take ownership and have fun with exercise. It's not another chore. This is the 69-year-old professor who shared with us this trophy, this medal. At 2018, he had a stent. 2018 fall and winter, he started enjoying exercise during cardiac rehab. Within another 6 months, he was able to participate and start winning. And then after winning, running events, he started doing more fitness training, resistance training, interval training to become even more fit. So this journey continues. There is no limit to how fit and how healthy we can get. Despite what number the age may tell you, you can get so much more confidence that comes from within, not from any slideshow that you're seeing. Okay. So that is what this whole thing is about. So to finish off, in this COVID world, how can we still find heart health? The negatives of the COVID, I have to tell you. The first thing is the COVID virus, the coronavirus gets to the heart. So we see that quite often. As a cardiologist, we see those patients more often, but it can cause direct damage to the heart muscle. It can cause heart attack. It can cause what we call Takasubor, stress-induced cardiomyopathy. All these things can directly be the effect of the coronavirus on our heart. But despite that, we need to look at the big picture. The positives in this COVID world for our society is that we have less job-related stress because we travel less, spend less time in the roads. Our job stress may be lesser. Many of us, unfortunately, may not have a job right now, but still work-related stress is lesser. And people are eating less fast food because they're not going outside to eat much. We end up obviously having more time with people that matter to us, our close friends, and definitely our family. And again, this chance and this time to reflect, to introspect is a new opportunity that we did not have until 2020. So this, I honestly believe, all these things stack up towards more self-inquiry, towards more heartful living. So I believe in the big picture, the balance is more towards resetting our life itself positively. So this high life is what we are hoping will be an introduction to yourself so that you can gain that much more confidence for moving forward in this new world that we have inherited. This is the last slide that I want to share with you. The newest slide is this patient's story. She sent me a beautiful card. I don't know if you can see the card, but I read the card and then I opened her chart, and this is the graph in there. The story is, now she is 82, but in 2015, she ended up needing stents in her heart. She had a fast heartbeat. She had a bleed in her stomach. She had anemia, liver failure, extreme obesity. This is when she's 77 years old, high blood pressure and very limited functional status. And this card she is sharing with me today is saying she's feeling so much better. If she can lose from 135 all the way to 120 kilograms, that 15, 18 kilos, which is like about 40 pounds at this age, despite so many health issues, we all can move a little bit more towards our own health and a little bit more towards our own confidence. So that is what I want to leave you thinking about. Excellent. We still have, I think, another 15, 20 minutes. No, about 5-10 minutes. So I guess we have time for a quick questions or a short comments before we have to wrap up our session. And we'll meet again next Monday, same time. Any quick questions, suggestions, comments?
Since nobody else has got anything, I'd like to congratulate you on your promotion to full professor.
Thanks, Dennis.
That's awesome.
Congratulations.
Thank you. Thank you. Any quick?
Hi, Dr. Anand. This is Nikhil here. I had a couple of questions. I have been following your 16 hours no eating for my testing. What is the solution? Because I have very weird work times. Because I work in film, and like certain days I have to, like work through the night and stay awake during the day, or rather sleep during the day. Do you have any suggestions in terms of adapting, because my schedule keeps changing constantly? Do you have any suggestions in terms of adapting it when my schedule for the day changes and it comes back to normal?
Excellent. See, being a physician, my schedule also is sort of not in my hands. A lot of times we have to come in the middle of the night to take care of patients. And I feel since I started fasting about 2-3 years ago, that my body is that much more flexible to cope with the life challenges. And altering sleep pattern itself is a big stress to the body and to the mind. You're coping with it because you're young and because you enjoy working in the film industry. But fasting will make you more stronger to cope with it. How to fast, how many hours to fast, I want you, being so young, to find it for yourself in that situation. This month, your work schedule may be slightly different. Next month, it may change a little bit. But by and large, if you can find on several days of the week that you're giving your body no food for 12 to 14 hours at some intervals, that will be good.
I do it every day. I think Sunday is my only break. And of course, because Sunday I like to have a couple of drinks too.
You should enjoy everything that you want to enjoy. But once a week, try to find a 24-hour interval where you are not working. You might actually find surprisingly that you can do your work when you're fasting. Today, I'm on service. That means I come to work at 6 o'clock in the morning. Now it is about 11 o'clock. So I've been seeing patients all morning, and through the rest of the morning and early afternoon, I'll still be seeing patients today. So this 1 hour is my break where I can actually sit down. But I'm also fasting, and I'm very comfortable with it. 2 years ago, I would have thought maybe I should get some food and I don't want to feel dizzy or faint. But after you learn natural ketosis, which is what this whole program is about, the body will create enough energy that we need out of the fat that is stored as normal reserve and healthy everybody. So that'll give you that confidence. But by and large, it looks like you're already doing way better than we can ask of a healthy person in the 30s. So I think you're on the right track. Keep smiling. And the night shift that you're missing out, try to catch up on the sleep. Through the week, if you catch up on your sleep, you're okay. This fasting and sleeping, you can keep them as independent things. If you're able to still fast 12 hours.
The idea is if I can be as healthy as you are at your age and how fit you are, I think I will probably be doing it pretty well then.
You're going to be even more fit because you started much before I did. I started only at 45. You're in your early 30s, so you are much better off than I will be. Wonderful, Nikhil. Thanks for sharing that. Any other
Wait, so I came in a little late. Why is everybody, I think Dennis, somebody just wish you congratulations. What happened?
I got a promotion. Now I'm professor.
Oh, congratulations. Oh, yay.
Thank you.
That's very nice to hear. Thank you.
Thanks.
Nikhil, I'm Dr. Chokalingam, your uncle.
Yes.
And you are appreciating Anand and you want to be like him. I thought you were going to say, I want to be like Chokalingam. The reason is, Now I am now 75, 76. I never knew, even though I am a cardiologist for the last 50 years, what Anand has been telling. But I am very firm in one thing. I've been enjoying everything I do. The moment if you are going to have a flow in your work, flow in your game, flow in your anything, if you're going to have a nice sense of flow in what you are doing, then there is no need to have a relaxation time, because you're going to feel the flow in your work. You are going to start enjoying equivalent to not working at all. That is what I am doing. Even today I am working 20 hours. I feel I have not worked at all because I am enjoying that. So your night shift, day shift, all these things is a mental block. If you start enjoying, doesn't matter night and left, when how many years, how many hours you are going to sleep, all those things. It all depends upon, don't be conscious about. But one important thing I want to tell all my friends here, whatever thing per day, you must have minimum 7 hours of sleep. Going to shift in the night or day, you must have 7 hours of preferable is a deep sleep, because you need the body that much of rest your body, 7 hours sleep. Apart from that, what Anand has been telling, enjoy everything. That's what I used to say. Work is worship. Work and worship. Work as worship. Nothing can be equated, because once you are going to enjoy, that's what my grandson Kevin used to say maybe 10 years ago, when you were enjoying equivalent not working at all. So that is a habit you must cultivate. That is what I want to say in short. You add any number of zeros after 1, you become more richer. 1 add 30 zeros, 40 zeros. Provided the 1 is in existence, that is what you are living, your life is. So adding zeros or losing 1 is no matter. That's what you all must follow, what Anand has been telling that. Enjoy every moment of your life. He recently had a long hours of driving. Now he is talking with us. I don't think Anand is differentiating the both.
Yes,
he is doing that.
So glad that you brought that up, Dad. So we showed this graph about playing tennis and reaching flow, but that is, people have asked me, if I'm not playing sport, can't I reach flow? The answer is, if you're doing dishes, if you're cleaning your floor at home, if you are doing any work or anything at all, you can reach flow. And like Dad mentioned, flow is just an expression. We can reach it and sustain it for life itself. And the way to do that is through gratitude. Be grateful for where we are. And that is something I thought we will share next week, but I'll tell in one quick second. I've been asking my patients a question: what are you grateful for? So many things they say, my grandchildren, my work, or that now I've got through this heart attack, whatever. But now in 2020, numerous patients are saying, I'm grateful, doc, for being alive. They're looking me in the eye and saying that. So that is self-inquiry that came not from heartful living, high life, participating in flow-inducing exercises or fasting for 24 hours. It is thanks to the coronavirus. It has made us recognize that others in our situation are not alive today, whereas we are still alive. So I am grateful for being alive. Like that, people are recognizing it. So that gratitude is so important. And this flow, I believe, with the help of the challenges that we are overcoming together, we will find it more and more in our day-to-day life. That is what this whole exercise is all about. Excellent, Nikhil, for the question, and Dad for clarifying that flow is not just a few minutes, it's about life itself. Excellent. And Dennis, can you tell me the name? I can put it in this group for everybody.
It's a YouTube site, and it's HasFit, HasFit. It's kind of all one word.
Hasfit.com.
Yes. It's actually go to YouTube and then put it in the search.
Okay. I'll just say YouTube. Okay.
They're very good instructions and all varieties of exercises, warm-up exercises, strength training, and very good instruction for any level.
Excellent.
Yeah, Anand, I did have a look at it. It has even for beginners, so
good.
Looks good. Looks good.
This
Thanks,
world
Dennis.
is so connected.
You're welcome.
You can quickly find things online. The current generation, they are saying the Gen Z, they are not learning from textbooks or any other lectures. They are learning. Most of education is happening on YouTube. So Dennis is very young at heart. That's why he's referring to YouTube.
Dennis, incidentally, that last speaker was my son, who's in LA.
Oh, okay.
So let me run for my next meeting. So nice we could connect. So I hope to see you all next Monday. Please invite any of your friends, family, anybody above the age of 10 we've been inviting. So all are welcome to join us next Monday. See you then.
Good
Thank
show.
you.
Great show.
Anand.
Thank you.
Thank you.
So much. Good night. Good morning, whichever way it is. Good day.
Good day.